Those measures continue to be the backbone of the response in all countries. But we also knew that we would need new tools, diagnostics to test for this new virus, therapeutics to treat it, and vaccines to prevent it. At the same time, we knew that we live in an inequitable world, a world in which children die from diseases that can be easily prevented with vaccines, and in which people die because their sickness goes undiagnosed and untreated. We knew that unless we took unprecedented action, the world's have-nots would be left behind again. So a year ago, WHO and the many partners who have joined us today came together to launch a unique initiative, the Access to COVID-19 Tools Accelerator. The ACT-Accelerator was conceived with two aims: the rapid development of vaccines, diagnostics, and therapeutics, and equitable access to those tools. The first objective has been achieved. We now have several safe and effective vaccines to prevent COVID-19. We have rapid diagnostics tests for it. And we have oxygen and dexamethasone to treat it. But we have a long way to go on the second objective. Around the world, people are dying because they're not vaccinated, they're not tested, and they're not treated. We're deeply concerned about the increasing number of cases and deaths in India right now. We know that the situation is complex and requires different responses in different parts of the country. And I welcome the steps the government has taken to reduce social mixing and boost vaccine production. I offer my deep condolences to everyone in India who has lost someone they love, and I offer my deep commitment that WHO and our partners in the ACT-Accelerator stand with the government and people of India and will do everything we can to save as many lives as we can. WHO has redeployed 2,600 staff from our other programs on polio, TB, neglected tropical diseases, and immunization programs to support states to respond. We're also providing technical support for the production of oxygen plants and advice on clinical management, including patient triage. The situation in India is a devastating reminder of what this virus can do and why we must marshal every tool against it in a comprehensive and integrated approach: public health measures, vaccines, diagnostics, and therapeutics. This is a scenario that's playing out around the world and will continue to play out unless we ensure equitable access to the tools needed to save lives. The solution is straightforward. We need countries and companies that control the resources that could save lives to share. That means sharing financial resources to fully fund the ACT-Accelerator. It means sharing vaccine doses to protect the most at risk, not just the most rich. It means all countries being transparent about their bilateral dose donations, so we know who has what. And it means sharing technology, know-how, and intellectual property to urgently and massively scale up production. The ACT-Accelerator needs $19 billion this year. That's a drop in the ocean compared with the trillions of dollars governments are spending on supporting their economies and the massive revenues that most vaccine makers are generating. It's not good enough to say that inequity is just the way the world is. It's not okay that people just like you and me die when we have the tools that could save them. We cannot accept the same old story. This is the time for all of us to write a new story, a better story that sees nations not as rivals or competitors, but as members of one human family with a common future. Call me an idealist. I will wear that badge with pride. In many ways, that's what the ACT-Accelerator is. One family of governments, agencies, civil society, the private sector, philanthropists, and others coming together to find shared solutions to our shared challenge. No one of us can do this alone. Creating the ACT-Accelerator was an achievement in itself, but leading it and running it has been an enormous and often unseen task. In September last year, we established a facilitation council led by South Africa and Norway to provide high-level political leadership and advice to facilitate the ACT-Accelerator's work. It's now my great honor to welcome His Excellency, President Cyril Ramaphosa, the President of South Africa. Your Excellency, thank you for your outstanding leadership and support for the ACT-Accelerator. You have the floor.
Director General of the World Health Organization, Dr. Tedros Ghebreyesus, Your Excellencies and colleagues, and Deputy Secretary General of the United Nations, ministers, and ladies and gentlemen. It is indeed my privilege to be part of this anniversary event for the Access to COVID-19 Tools Accelerator. Just over a year ago, on the 24th of April, 2020, we made a commitment to fight the COVID-19 pandemic together as a united front. When we established this collaboration, it was to ensure that diagnostics, therapeutics, and indeed vaccines for COVID-19 would be accessible to all. And in the end, we were committed that no country should be left behind. We have indeed come a long way. Since its establishment, the ACT-Accelerator has supported the fastest, most coordinated, and successful global effort in history to develop tools to fight a disease. We have supported over 70 countries to expand laboratory infrastructure and ramp up testing. Through the Health Systems Connector, we have been able to assess country readiness for vaccine development and deployment in more than 140 countries. We've also established a common knowledge sharing platform where we are able to share each other's experiences. And we've also procured personal protective equipment with a value of more than $500 million. Through COVAX, we have been able to deliver more than 38 million doses of life-saving vaccines to over 100 countries. However, we have a great deal of work to do to ensure equitable access to rapid diagnostics, oxygen, and dexamethasone. This will be done through the therapeutics pillar and the COVID-19 Oxygen Emergency Task Force. We should say that vaccine nationalism seriously threatens the global recovery from the pandemic and is deepening inequality between countries. The COVID-19 vaccine is a public good and must be recognized as such. To overcome challenges with access, low and medium income countries must be supported. Yes, to have access to vaccines, but also to be able to manufacture their own vaccines, diagnostics, and other treatments. As a continent, Africa has embarked on an ambitious drive to work towards the development of pharmaceutical manufacturing capacity so that it can supply the continent's people with the vaccines and other medical supplies they need. To use the existing vaccine manufacturing capacity in developing countries and to enable further development, South Africa and India are calling for a temporary TRIPS waiver to respond to COVID-19. This, in our view, will facilitate the transfer of technology and international property to more countries for the production of COVID-19 vaccines, as well as diagnostics and treatments. We are greatly encouraged by the strong support for the TRIPS waiver proposal from over 100 countries, as well as from 130 civil society organizations, as well as a group of 70 former world leaders and more than 100 Nobel laureates. We welcome the initiative by the World Health Organization to establish a COVID-19 mRNA vaccine technology transfer hub. We call on the pharmaceutical industry to directly transfer this technology free of intellectual property barriers to low and middle income countries through either the WHO hub or the COVAX facility. And we appeal to the international community to help mobilize the $19 billion urgently required by ACT-Accelerator to implement its 2021 priorities. Just as we worked together to ensure equitable access to medicines to respond to the HIV/AIDS pandemic, I think we should work together now, much more so now, largely because COVID-19 has encompassed the whole world and affected so many people, all at one go around the world. Let us together challenge vaccine nationalism and ensure that protecting intellectual property rights does not come at the expense of human lives. This is all the more pressing as many countries now face a resurgence of infections. As we have done so effectively in the past year, I'd like to believe that we can continue to confront this global health crisis in a spirit of solidarity, in a spirit of partnership as well. Let's face it, it is only through collaboration that we will be able to overcome this devastating pandemic. In my view, there is no other way in which we can confront this pandemic other than working in a collaborative way, in a cooperative way, and standing together instead of standing against each other. Now, ACT-Accelerator has enabled us to work so close together in an unprecedented way. Let us take this great lesson for working together forward and be united in everything that we do. I thank you, and this is a great moment to bask in the wonderful work that we have done over a year and prepare ourselves for greater things that lie ahead. So thank you very much. I'm delighted to be part of this event. Thank you.
Thank you. Thank you so much indeed, Your Excellency, and my deep appreciation once again for your exemplary leadership domestically, regionally, and globally. It's now my pleasure to welcome His Excellency Dag Inge Ulstein, the Minister of International Development of Norway. Minister, thank you for your leadership as co-chair of the ACT-Accelerator Facilitation Council and for joining us today. You have the floor.
Thank you so much. Thank you so much, Dr. President Ramaphosa, colleagues, friends. It has been a year of contradictions, a year of confusion, consternation, competition, and cooperation. Bad news and worse news have been competing for our attention, but there has indeed been some good news too. The virus has shown to what a degree we all share the same destiny, while also demonstrating dramatic degrees of inequality, expanding existing gaps even more. 1 year ago, we were keeping our fingers crossed that a new vaccine against a new virus could be developed within a year, even if we knew that at least 6 years was normal. But it happened much sooner. Together, we have managed to turn ACT-Accelerator and COVAX into unprecedented mechanisms of international cooperation, an unprecedented response to a pandemic without precedent in modern times. Faced with a virus that is totally disrespectful of borders, our fight against it must also cross borders. We all understand this. However, it seems to me somehow as if the leaders of the world still haven't fully woken up to the fact that the coronavirus is capable of crossing borders. Continued lack of financing for the ACT-Accelerator poses a major obstacle to its ability to deliver at scale. If we are to bring the pandemic under control, there is an urgent need to close the funding gap of $19 billion. A further delay in the funding will cost more lives and even greater economic harm. As long as the pandemic is allowed to prosper in poor countries, it may not just mutate and produce new variants that are dispatched to countries that are already vaccinated, it will also keep the world economy from regaining speed. As co-chairs of ACT-Accelerator, President Ramaphosa of South Africa and Prime Minister Solberg of Norway have sent out letters to 89 countries asking them to contribute their fair share. Together with other members of the Facilitation Council, we are actively engaging in bilateral outreach to secure it. At this 1-year anniversary, our choice is simple. Invest in saving lives by treating the cause of the pandemic everywhere, now, or continue to spend trillions on the consequences of the pandemic, with no end in sight. The case for global collaboration couldn't be stronger. As a colleague said in the last ACT-A meeting, a once-in-a-100-year event requires a once-in-a-100-year level response of cooperation and global solidarity. We cannot relax until everyone, everywhere, has access to vaccines, tests, and treatments. The time to act, to accelerate, is now. Thank you, and over to you again, Dr. Tedros.
Thank you. Thank you so much, Minister. I have enormously valued your leadership and friendship over the past year. And thank you so much again. Since the earliest discussions about the ACT-Accelerator and throughout the past year, the President of the European Commission, Ursula von der Leyen, has been a steadfast partner. I thank President von der Leyen for her leadership and partnership, and it's my honor to welcome her to make a statement.
Dear Dr. Tedros, distinguished guests, I remember very vividly those days of April last year. The world had been caught by surprise by the pandemic, and the response of too many leaders was my country first. We made a different choice. We knew that we needed to fight this virus not just at home, but in all continents and all countries, from Asia's mega cities to Africa's most remote villages. And for this, we needed to act fast and act together. And this is how the ACT-Accelerator was born. I am proud that Europe was part of its inception from day one, and a special thanks to you, dear Dr. Tedros, and the team at WHO for getting the ACT-Accelerator off the ground so quickly. And many, many thanks also to you, dear Cyril Ramaphosa and dear Erna Solberg, for taking on the leadership of the Facilitation Council. Already in early May 2020, Europe co-hosted a first pledging conference to raise money for this initiative. Many other pledging events followed suit. Europe helped raise billions of euros for ACT-Accelerator. But what I really love about ACT-Accelerator is the team spirit. ACT-Accelerator wasn't created as a new institution, but a new way of working together. We all mobilized the World Health Organization and national governments, UN agencies and philanthropists, NGOs, and the pharma industry, because every one of us has something to contribute. ACT-Accelerator brought together all health actors and empowered them to do more and better together. Thanks to this cooperation, ACT-Accelerator has achieved so much in so little time. ACT-Accelerator helped identify a life-saving therapy against COVID. Thanks to ACT-Accelerator, COVID tests are now available in low-income countries for less than $3. And its vaccine pillar, COVAX, is now shipping vaccines at an affordable price or for free to over 100 countries. None of us could do this alone. But together, we achieved a miracle. Every cent that we put into ACT-Accelerator has been a good investment. And we will need more of this in the months ahead. Because the pandemic is far from over, we need ACT-Accelerator perhaps even more than 1 year ago to track the virus as it evolves, to scale up manufacturing, to deliver vaccines to all corners of the world. ACT-Accelerator has a funding gap of $22 billion. The European Commission has just doubled its contribution. And let me invite all governments, but also the private sector, to step up. Because this is how we can end the pandemic. Joining forces as a team, as Team Human. This is the spirit of ACT-Accelerator. And Europe is playing for the team. Happy birthday, ACT-Accelerator.
Thank you so much. Happy birthday, ACT-Accelerator. One of the first and most decisive calls we had early last year at the ACT-Accelerator was starting to take shape was with President Emmanuel Macron of France. And President Macron has continued to take an active interest and to play an active role in the ACT-Accelerator. To mark this first anniversary, we have asked President Macron to reflect on the year that has passed and to look forward to the opportunities and challenges that lie ahead.
Monsieur le Directeur Général,
Director General, dear Dr. Tedros, ladies and gentlemen, heads of state and government, friends. When the pandemic was announced by the World Health Organization in March 2020, I announced that on behalf of France and the French people, I would launch an international, because the health of our fellow citizens requires international action that is effective. So we cannot allow health systems to collapse. We cannot allow the virus to run out of control across entire regions. The appearance of new variants demonstrated our health also depends upon the poorest countries, and all of us here today worked extremely hard to urgently implement a tool that has allowed us to meet this ambition, to give access to products to fight COVID-19 to everyone. It was on the 24th of April 2020, the ACT-Accelerator was launched. 1 year later, collectively, we can be proud of what we have accomplished. Even though there's a great deal to do, $11 billion have been mobilized, 191 countries have joined the group for the procurement mechanism called COVAX. The volume secured will allow us to reach the target we gave ourselves of vaccinating 20% of the population. I want us to be able to go further, particularly in regards to the African continent. More than 40 million vaccine doses have already been distributed in 114 countries. A few numbers, a few realities that are the first successes of the ACT-A initiative launched 1 year ago now. But now we must continue our efforts to go faster, stronger, because it's a race against time in this pandemic. Today, despite all the figures I've given, it's still not a satisfactory situation. 1 person in 6 has received at least 1 dose of the vaccine in Europe. 1 person in 5 who has received a dose in North America. And alongside that, in Africa, it is less than 1 in 100. That is unacceptable. There is one very simple response. All states who have purchased COVID can participate. And I would like to say that all those who have pre-ordered vaccines, many vaccines, including France, the European Union, we have a responsibility with regards to the rest of the world. We knew, especially in Europe, when we signed procurement contracts with all the big laboratories. One of our conditions as purchasers was to one day be able to donate or resell our doses. We didn't want to take the risk of depriving the rest of the world of such precious vaccines. Now the time has come to share. Of course, we have a vaccine campaign to carry out in each of our countries. Our most vulnerable populations are progressively being covered, and we will continue to receive more and more vaccines. And we have the means to accelerate our solidarity by donating vaccines. That's why I am announcing today that France has just sent their first COVAX doses. These AstraZeneca vaccines are going to West Africa now in accordance with the COVAX fair distribution mechanism. Our goal with these donations is to allow all countries, especially in Africa, to vaccinate the priority populations, starting first of all with healthcare professionals. This is a commitment that we made together at the G7 summit in February, and we will keep to it by June. Of course, we will share more and more vaccines, at least 500,000 doses by mid-June, with an increasingly diversified basket of vaccines so that we can meet the different challenges of the population. What is essential in this commitment, I think, is that we have made the choice to donate to COVAX. In fact, vaccine allocation must be based on objective criteria, which only the World Health Organization is able to give us via the COVAX mechanism, and that is its role. And that's why I'm appealing to all my fellow citizens to commit to sharing doses of vaccines. I mentioned a target of 5% in February, but I can already say that we will pass this figure by the end of the year. Then there are many other things that we have to do, but Donating vaccines is essential. As countries, we have other ways of improving effective access to all the tools to combat COVID. Ensuring transparency in procurement contracts so that we can fight against commercial practices which are unfair to more vulnerable countries. The international system today lacks transparency in delivery criteria, conditions, dates, prices. Then, to guarantee that we will mobilize all production facilities for vaccines so that they can be converted throughout the world. No continent should be excluded from the production. It's essential, and this involves licensing agreements and technology transfer. We hear a lot, in fact, about the transfer or lack of intellectual property rights, but we know that's not the issue. The issue is transferring technology and mobilizing production capacity, because that's where the bottleneck is. I'm giving a clear message to all vaccine manufacturers to commit to such a process. Global access is our collective responsibility. Countries, international organizations have an essential role to play, and so does the private sector. So we must all cooperate with the medicine patent pool to identify underused production capacity, to maximize and accelerate the transfer of technology, and allow the production of more doses of this valuable vaccine. Then vaccination is essential, but in order to be effective, it must be supported. First of all, by an improvement in our diagnosis and sequencing capacity so we can track and combat variants. I want to highlight the exceptional work carried out by the African CDC, supported by AFD and our research institute and the Pasteur Institute network. This project will improve the work against the pandemic in Africa, protect the most vulnerable, and guide procurement choices for vaccines. Vaccine must also be accompanied by structural movement to strengthen healthcare systems, which is the cornerstone of all methods of fighting the pandemic. And we have to come out of this crisis stronger. It's a central priority for me, and the French Development Agency has committed significant amounts, and we've just approved another €1 billion to help healthcare systems combat COVID. The World Health Assembly on the 21st of May, with its summit, will facilitate the recording of all our meeting points on this issue. We must meet today's challenges to find a collective response, and we must also build on this unprecedented situation and learn all the lessons to change the global healthcare system. It must be more robust, inclusive, and more effective to deal with future pandemics. A reformed, strengthened World Health Organization must be the cornerstone. Many things are being decided today. The credibility itself of multilateralism in the area of health is being decided today in our capacity to rapidly deliver vaccines in the field in Latin America and South America and Africa, in the Pacific as well. It's up to us. And so I'm counting on each of us. We will be here. Thank you.
Thank you. Thank you so much, Your Excellency, President Macron. And thank you to you and France for your generous donation to COVAX. I hope other countries will soon follow your example. The strength of the ACT-Accelerator is that it has been supported strongly by governments all over the world. Now it's my honor to introduce 3 leaders who have been unwavering in their support. Prime Minister Mario Draghi of Italy, President Paul Kagame of Rwanda, and President Pedro Sanchez of Spain. Dear Director General, dear colleagues, the pandemic has shown us the importance of international collaboration in the realm of public health. Viruses and infectious diseases know no borders. COVID-19 quickly spread from China to the rest of the world and has claimed so far at least 3 million lives globally. Regrettably, our initial response lacked coordination. The global community failed to share information promptly and adequately. We struggled to understand that what was happening to another country would quickly happen to us too. Global threats require global responses. We will not be completely safe until all countries are safe. The ACT-Accelerator, born a year ago, is an excellent example of what we can achieve when we work together. It aims to support the development and equitable distribution of the tests, treatments, and vaccines needed to bring the pandemic under control. It treats global health for what it really is, a public good. This is why, since its inception, Italy has been amongst its strongest supporters and main contributors. We now see an end to the worst of this pandemic. Thanks to global cooperation, scientists have developed a number of effective vaccines that can save lives and help us return to a normal life. But this success cannot be a source of complacency. We have to be more ambitious. We need to scale up research and development to fight new variants. We need to strengthen our health systems. We need to ensure equitable access to diagnostics, therapeutics, and vaccines, also in low-income countries. This year, Italy holds the presidency of the G20. Overcoming the pandemic and ensuring a sustainable and resilient recovery are at the heart of our agenda. We have emphasized the role of the accelerator in fostering global immunization according to transparent, agreed rules. We want to scale up the capability of the COVAX facility to achieve equitable distribution of safe and effective vaccines. Thank you.
Excellencies, WHO Director General Dr. Tedros Adhanom, distinguished ladies and gentlemen, I am pleased to join you in marking this first anniversary of the access to COVID-19 Tools Accelerator and commend Dr. Tedros and the WHO for leading this important response to the global pandemic. For many developing countries, the ACT-Accelerator has been the only way to access life-saving COVID-19 testing kits, vaccines, and treatment. As the pandemic continues to evolve, often in an unpredictable manner, much more needs to be done to remove barriers to affordability and equitable distribution. In particular, Africa lags behind in the manufacture of vital products for COVID-19 prevention and management. Efforts are underway to build this capacity, but this requires support across the board to ensure that it's done properly and quickly enough to make a difference in the ongoing pandemic and improve preparedness for the next one. Rwanda remains committed to the goals of the ACT-Accelerator. By now, there are lessons to learn in order to make this effort more effective. We will continue to work together with the WHO and other partners to defeat the COVID-19 pandemic. I thank you.
Una iniciativa inédita y necesaria.
This is an unprecedented and new innovation from ACT, working through diagnostics.
All right, let's come out of that one. That is the WHO briefing. And of course, we saw our President, Cyril Ramaphosa, participating in that virtual event to mark the one-year anniversary of the World Health Organization's access to COVID-19. Now, the President also noting that there are still very many challenges that the country is facing, that many countries are facing, pardon me, one of them being the resurgence of infections. We also heard from the French President, Emmanuel Macron. So that's a special conference on Accelerator's first anniversary. All right, we'll have more news after this.